Today I am going to discuss about the dryness of mouth that is also called xerostomia. This is very common presenting complaint in OPD. At the end of the presentation, you will be able to what are the different types of xerostomia or dryness of mouth, and what is the differential diagnosis, how to elaborate a patient with xerostomia, how to investigate the patient, and what is the treatment of xerostomia. Now, first of all, there are two types of xerostomia. Number one is the true xerostomia, in which there is absolute or relative deficiency of saliva production. This is the absolute deficiency, in which most common is the Sjogren disease, that is the autoimmune mediated, or other autoimmune mediated diseases that lead to destruction of the salivary glands. Second is the pseudoxerostomia, that is also called symptomatic xerostomia, in the course of which the patient has a subjective impression of oral dryness despite normal secretory functions. In OPD, this type of xerostomia is more common than the true xerostomia, but always think about xerostomia. Next is the differential diagnosis. Always rule out physiological xerostomia. Some patients in old age have relative deficiency of saliva. Sometimes there is extreme hot weather. Physiologically, there may be dryness of the mouth due to hot weather. So, before thinking about any disease, always rule out these two physiological conditions. Now, the first of all, the most important and the most common cause of xerostomia is the diabetes mellitus. Always ask about diabetes mellitus. Next is the metabolic disorders, that is the hypercalcemia, anxiety, depression, autoimmune disorder, Sjogren, rheumatoid arthritis, systemic lupus erythematosus. And obviously malnutrition is also a very common cause, in which the trace elements magnesium, calcium, and vitamin deficiency lead to the dryness of the mouth. Next is the medication. Most of the patient are multiple medications that can cause dryness of mouth, especially tricyclic antidepressant and antihistamines. And next is the already we discussed physiological, due to the old age or due to hot weather. Now, how to make a diagnosis? Obviously, there are four steps in the diagnosis. First of all, history taking. History taking is the cornerstone to make the diagnosis. Second is the how will you take a history of patient presenting with xerostomia. First of all, does patient complain of dryness of mouth? Yes. Then ask about dry mouth questionnaire. Does the amount of saliva in your mouth seem to be too little or too much, or you do not notice it? Do you have any difficulty in swallowing? Does your mouth feel dry when eating a meal? Do you slip liquid to aid in swallowing dry food? If yes, then always get a medical history and review of systemic symptoms. Does patient have any known risk factor of previous illness which we discussed? Yes. Then clinical evaluation. Does patient manifest any of the following condition? If patient has a risk factor of medical illness and there is dryness of the mouth, then consequences of dryness of mouth elaborate by asking and checking the major salivary glands, Is there any enlargement, tenderness, no saliva and palpation, no saliva pool, saliva contaminated with pus or blood? Check the lips for dryness, chapped, fissure, and erythematosis. Then is the mucosa and tongue. Same is the check for dryness, erythematous, lobulated, and fissured. And also check the dentation for extensive restorative experience, rampant caries involving incisal, cervical, or root surface. If yes, then consider for diagnostic workup that we will discuss in the next slides. This is the consequences of dryness of the mouth and confirmation of the dryness of the mouth, and especially these symptoms suggestive of true xerostomia. If there is true xerostomia, always think about diseases of the salivary glands. If xerostomia is not true pseudoxerostomia, then think about the systemic illnesses. After taking the history of diabetes, then ask about the triad of the Sjogren disease, that is the polyarthritis, dryness of the mouth, and dryness of eye. Also rule out other autoimmune diseases by asking the morning stiffness, mouth ulcers, especially history of the systemic lupus erythematosus and rheumatoid arthritis. Ask about patient medication history and elaborate the GIT symptoms, especially for malnutrition, and ask about helplessness and hopelessness to rule out the anxiety and depression. Now, there are many drugs which are responsible for xerostomia, especially these are the diuretics and the anticholinergic drugs. There are few medications that has anticholinergic effect. These are the antidepressants, antihistamines, and the drugs which are used for incontinence and antipsychotics. These medications can cause dryness of mouth by anticholinergic effect, especially if patient has ischemic heart disease. And in diuretics, then diuretics especially can loop and thiazide diuretics, carbonic anhydrase inhibitors, and potassium sparing diuretics. These diuretics can cause dryness of the mouth. Especially important cause is the nicotine, smoking, and alcohol. These are also directly inhibit the saliva production and also cause the xerostomia. Also consider these two important causes. Next is the examination. In the examination, typical sign of xerostomia during oral cavity examination, they may identify dental mineral sticks to the tongue or buccal mucosa, and there will be no saliva pooling, and you will notice cervical caries. Rest of the examination, maybe there is arthritis and redness of the eye, swelling of the salivary glands. Now, next important steps: how to investigate patient with suspected case of xerostomia. First of all, do the blood sugar levels and HbA1c to rule out the most important and common cause of xerostomia, diabetes mellitus. Then get the autoimmune profile that consists of ESR, CRP, ENA profile that have the all autoimmune profile including ANA, double stranded DNA, anti-SSA, anti-SSB, and all the autoimmune profile. Then is the biochemical profile that consists of calcium, renal function test, thyroid. Obviously, endocrine diseases, hyperthyroidism also cause xerostomia, free T4, liver function test, and urine complete as a baseline investigation. Then after the investigation, you will be able to make diagnosis. There may be diagnosis of anxiety, that is the most common cause of medications of xerostomia. There may be the autoimmune disease. Then treat according to the diagnosis. General measures of the xerostomia are: educate the patient regarding illness and ask the patient to avoid salty and spicy meal and take the plenty of fresh fruits and vegetables, avoid smoking and alcohol, then give the patients trial of multivitamins along with calcium, magnesium and zinc trace element to replace the malnutritional elements. Obviously, if patient has anxiety, then treat with SSRI or anxiolytic. And if there is a primary Sjogren or disease of the salivary glands, then treat according to the patient's symptoms. In the first step, there will be the tropical topical therapies, in which mechanical and gustatory stimulation, saliva substitute, and in the second step we will get the pilocarpines, that is the cevimeline. If patient has intolerance or contraindicated, then we can use N-acetylcysteine.